Cool, so we've been called out to a job where a female's fallen from a tree. We arrive on scene and we notice that she has a laceration on her left arm and an angulated right ankle. Because she's on a grassy surface, it's difficult to estimate the amount of blood that she's lost. Her saw that she was used to cut a tree is in the distance, but she is kind of like moaning and looking around and appears to be quite conscious and pink and well perfused. I don't assess any other dangers. Do you feel safe entering?
Mm-hmm.
Cool. Hello there, we're from the ambulance service. My name is Sam and this is my officer James.
Hiya.
What's your name?
Maddie.
Maddie. Okay, well I've noticed that you've got a bleed on your arm. Is it alright if I assess that just real quick?
Yeah.
Right, my officer James is just going to be getting a set of vitals.
Yeah.
Which might involve some tension in your arm and just listening to your chest and stuff.
Okay.
Right. So I'm just getting some saline to clean out the wound and wet the gauze and applying some pressure. So how did you fall out of the tree today?
I just got distracted when I was trying to cut it and I slipped.
Distracted by what?
A cat.
Yeah. Alright. Did you feel dizzy at all before you fell?
No.
So I noticed that the gauze is bleeding through. So I'm just going to apply a bandage to improve the amount of pressure. Just doing a few normal wraps and then doing some twists over the site of the injury to apply further pressure. So because she is on a grassy surface, things that we could be concerned about are things like hypovolemic shock, because we can't estimate the amount of blood that she's lost. How long have you been waiting?
Oh, I don't know, maybe like 15 minutes.
15 minutes, okay. So just keep that elevated. What's her blood pressure?
110/70.
110/70. So it doesn't appear that she is hypovolemic at all because she hasn't lost a lot of blood, but she is bleeding through the first bandage, so I'll just be applying a second. Again, applying twists in the bandaging just to apply
So we'll be putting the stethoscope in your chest.
further pressure.
Deep breath.
So I'm just checking for a pulse just to make sure that I haven't cut off any circulation to the hand, which I haven't. Cool. So you just keep that elevated, please. So are you on any medication?
No.
No. Okay. At this point, I noticed that she's still bleeding through her bandages. So, mate, I'm going to have to apply a tourniquet. This will feel quite tight
Yeah.
on your upper arm, but it's necessary to stop the wound from bleeding. You might feel your fingers go cold and even numb, but that's just a normal side effect.
Okay.
So it's important that when applying a tourniquet that it is on a single boned limb, at least 10 centimeters proximal to the wound, and that you don't remove it until you reach hospital, and that you write down the date and time that you apply the tourniquet. Additionally, you remove the bandages so that you can visually inspect the bleeding has indeed stopped, and then just keep it elevated from then on. We'll also be checking for a pulse and just a cap refill, just to make sure that the bleeding has stopped and that there is little to no blood flow. So we see that the wound has stopped bleeding and that there is no pulse and that the cap refill is severely delayed. So mate, I'm just going to do a quick head to toe sweep of your body. It is going to involve me prodding and touching different parts and limbs of your body. So it is quite invasive, so if you feel uncomfortable at any time, just let me know.
Yeah.
Are you okay with this?
Yeah.
Okay. So it's just to check for any hidden injuries that we can't see at the time.
Okay.
So just starting at the head, I'm just feeling for any bleeding and movement. Just checking the ears for any blood because it would indicate high intracranial pressure. Out, just going down the neck, it hurts?
Yeah.
Yeah, okay. Is that in the middle or is it off to the side?
No, it's more in the middle.
So it's in the middle?
Mm-hmm.
Right, so due to the high mechanism of injury and midline C-spine tenderness, she might likely have a cervical spine injury. So James, can I just get you to support the head while I do the rest of the trauma suite?
Mm-hmm.
Cool. Cool, very good. So just checking the arm for any fractures. No? Okay. Just going down your sternum.
Mm-hmm.
Cool. Can you just get you take a deep breath? Very good. So there's no loose ribs. Just palpating the stomach. There's no rigidity, so that doesn't indicate internal bleeding. Just checking the pelvis is intact, which it is. Very good. Just checking for any bleeding down the legs.
Ow.
Ow?
Yeah.
Does it hurt as I go down?
Yeah, yeah.
Yeah? What about over here?
Yeah, a little bit, but not so much.
Okay. So because her ankle is angulated and that she is receiving pain above and a little bit below the limb, it would indicate that she has a fracture there. But in the meantime, we're concerned about your neck.
Mm-hmm.
So I'm just going to go get a C-spine collar and a couple of towels to support your neck to reduce any further injury, okay?
Mm-hmm.
Cool. So to measure a C-spine collar, you measure the distance between the shoulder and the jaw and select the appropriate height on the collar, which would you can vary by pushing in and out of these tabs and then moving the yellow bar up and down. So because the appropriate height is selected, we're just going to slide this under your neck very carefully, trying our best not to do any unnecessary lateral movement. Very good. Make sure that's secure. You comfortable like that?
More or less.
More or less. Right. And we're just going to pack these into the side, again just to reduce any unnecessary lateral movement, but also to free up my offsides hands.
Mm-hmm.
Right, so with your head secure and your bleeding stopped, I'm going to be thinking about some pain relief for you, just because your arm will probably be feeling quite sore,
Yeah.
and also because we discovered that you had a potential fracture, which was also going to be quite sore. What's your pain out of 10? Like 10 being unbearable and 1 being like a tickle?
Like 7 or 8.
7 or 8?
Pretty bad.
Right, so it's quite high.
Yeah.
So James, I'm going to get you to get the splint and set that up for me,
Mm-hmm.
and I'm just going to be going over some analgesia for Maddie here. Okay, cool. So Maddie, have you heard of methoxyflurane before?
No.
So you've never seen this before?
No.
Are you pregnant?
No.
No. Do you have any kidney problems?
No.
Do you or your family have a history of malignant
I
hyperthermia?
don't know what that is.
Cool, and you're not allergic to this?
I don't think so. I've never had it.
Very good. So I'm just going to be checking with my offsider once he gets back, just the dosage and the expiry date, and then I'll coach you on the use of this particular pain relief, okay?
Okay.
James, could you just name the drug, the dosage and the expiry date, please?
Sure thing. Methoxyflurane, 1 ampule, 3 mils, and 2020.
Cool. Very good. So can you give me your non-tourniquet arm?
This
Very good. So she can obey commands, so I'll be happy to instruct her as to how to use this. So Maddie, what you'll need to do is just breathe it in and out of the green whistle, and then after you've taken a few breaths in and out of the green whistle, just take a few normal breaths.
Yeah.
If you need a stronger dose because it's just not working as well, you can put your finger over this hole here, and it'll just provide a slightly stronger dosage.
Okay.
Okay?
Cool.
So can you just take a few deep breaths for me, Philip? So I'm happy that she understands how to use the analgesia correctly, and later on we will be thinking about how long-term pain relief. So now that I've instructed Maddie as to use some fast-acting pain relief, we'll move on to splinting her leg. I've already instructed my offsider James to place triangular bandages under gaps so. So Maddie, I'm just going to do some quick assessments of your leg. Can you feel this on each leg?
Yeah.
Yeah? Can you wiggle your toes for me? Can you push up against my hand? Very good. Okay, I'm just going to check for a pedal pulse. And cat refill. So her neurological baselines are there, but it is a lot weaker on her affected leg, and her vascular baselines are also a bit weaker in terms of the strengthened consistency of her pulse. So Maddie, we're just going to be splinting your leg at the moment to try and correct these differences between your feet.
Yeah.
So I'm going to get you to take a couple of deep breaths of that pain relief. Very good. I'm going to be supporting the leg, and I'm just going to get you to slide that under on the command to lift.
Sure thing.
So I'm just going to be supporting the leg above and below the injury site. You ready, Maddie?
Yeah.
Very good. What's your pain scale like now that you've got the methoxyfluoride?
Yeah, it's gone down to about 5, I think.
5? Okay.
Yeah.
So on the command lift. Ready, set, lift. Very good. So now that Maddie's leg is realigned, we should see a slight improvement in terms of her vascular baselines. Can I get you to wiggle your toes for me, please? Right. So her movement is a bit more. Can you push against my hands? Cool. There's a bit more movement, and her pedal pulse is a bit stronger, and her cat refill is about the same as the other foot. Very good. What's your pain like now, Maddie?
Oh, it's gone down quite a bit, eh?
Okay,
Maybe like
very good.
3, 4.
So realigning her limb does seem to, and splinting it does seem to have reduced her overall pain. So with Maddie's bleeding under control, her C-spine injury contained, and her leg realigned and splintered, I'm going to send James off to go get the stretcher and the scoop while I perform a set of vitals and talk about some long-term pain medication for Maddie here. So Maddie, James has probably already he has gone over how a set of vitals with you. So I'm just going to be doing that again. Is that all right?
Mm-hmm.
Okay. So with a blood pressure cuff, we're just going to be aligning the arrow of artery to the point where the artery crosses over on the elbow joint. Just going to strap that in. And we're going to be increasing the pressure of the cuff to the point where we can no longer hear any pulsing, and then reducing the pressure until we can, and then we eventually can't again. So we increase the pressure to 140, cannot hear any pulsating of the blood. We slowly decrease the pressure, and we can hear the pulsating start at 110, which gives us our systolic pressure, and then the pressure drops off at around 80. So we can no longer hear any pulsating of the blood. So her diastolic pressure is 80 and her systolic is 110. Doing a quick heart rate pulse check. We feel for the radial pulse, and we start counting. We'll count for 15 seconds and then multiply the value by 4 to get a total of beats per minute. So Maddie has about 80 beats per minute, which is within the normal range of 80 to 100. Her blood pressure is 110/70, which is a bit lower than the average of 120 on 80, but not by much. Just going to do a quick auscultation. Maddie, can you just take a deep breath for me? Very good. Another. Very good. Another. Again. Very good. So Maddie is demonstrating some a bilateral air entry into her lungs. and there's no crackling or any abnormal sounds. Just going to be checking for a rest rate. Typically you'll do this alongside your pulse check because it's basically the same manoeuvre, except for instead of counting the beats per minute, you're counting the amount of times the chest rises or the stomach rises. And you do this for, again, 10 to 15 seconds, and then multiply the value by 4. The range for rest rates values between 12 and 20, and she's sitting comfortably within that range at about 15. If she demonstrated that she had low blood pressure, such as 90 on 40 or something, extraordinary like that, we would be very concerned about hypovolemia. If she had a very high heart rate, she could be above 100. She would be tachycardic. And if she had a very low rest rate, we'd be concerned about respiratory issues. So Maddie, I'm just going to be talking to you about paracetamol as a long-term form of pain relief. Just because methoxyflurane is short-acting, and we'll just give you something in combination with it to hopefully dull that pain even further.
Yeah.
Right. So you look as if you're under 80 kgs. Is that correct?
Yeah.
Yeah. Okay. Very good. So that means that we'll be giving you 1 gram, so 2 500 milligram tablets.
Yeah.
Would you be comfortable swallowing these tablets?
Yeah, I can try.
You can try. Okay, very good. So just before I get those for you, do you have any liver problems?
No.
No. Have you had paracetamol before?
Yeah.
Have you had it within the last 4 hours?
No.
No. Are you allergic to it?
No.
No. Well, you've had it before. So I'll be comfortable giving you paracetamol as a long-term form of pain relief. If you can't end up swallowing it, we can give it to you in liquid form, place it in a syringe, and give that to you.
Cool.
Cool. Okay, so with the bleeding now stopped, Maddie, I'm just going to do a quick sweep of your body. It's going to involve some prodding and some touching of the different parts of the body and the limbs. This is quite invasive, so if you do feel uncomfortable at any time, do just let me know. Cool. So starting at the head, I'm just doing it. Oh, I don't have gloves on.